We are in a period where we're seeing an increasing number of cases, and this is not unexpected. People may have seen across Europe, we're seeing cases tick up, Germany, Denmark, France, for example. So as I say, this is not unexpected. We are in a different position this year in terms of we do have a vaccine. In the main, that is protecting people against severe disease. But we would like to remind people, please, if you're offered a booster, take up that offer. We will be rolling out the booster programme. As you said earlier in the programme, we have received more supplies and we will be receiving more from the UK.
So what would you say to people who now might be questioning the point of the vaccine, taking up that offer if we are seeing such a rise in cases?
So we know that with all vaccines, our immune response fades over time, and COVID vaccines are no different to other vaccines. So that's why we need to boost our population. And indeed, what we're seeing in the older age groups who have been boosted, that it is protecting them against disease.
Well, if we're not looking at a lockdown, I suppose some sorts of restrictions or measures must be explored. What types of measures might public health consider should the cases continue to rise?
So we look at a range of measures and I advise ministers around that in terms of looking where our transmission is happening. And at the moment that transmission pattern has changed. Up until mid-term we saw very localised small outbreaks. What we're now seeing is more generalised transmission happening between households and across the community. So this is why we're wanting to remind people the importance of think about social distancing, think about mixing, think about your mask wearing. You know, I've seen many people, masks are slipping, particularly on public transport. Please think about wearing your mask properly and taking responsibility and not crowding in big groups together.
You mentioned some other countries in Europe that have seen a rise in cases but are still continuing. Denmark, for example, I think we spoke about earlier. They've looked at introducing masks again and limiting household mixing. So are these some of the measures we could expect to hear more of if this does continue?
So we're looking at a range of measures in our strategic coordinating group, you know, learning from what works across the whole of Europe. At this stage, we're watching closely because it's a balance between the number of cases we've got, the severity of the illness. As you said, we've got a very small number of cases in hospital at the moment, so the measures we put in place have to be proportionate to that. Offset against, as I said, the important way out of this is the booster programme, and we'd really encourage everybody to take up the offer of a booster.
Well, with that booster programme, there are reports of some people reacting negatively to the vaccine. Why would you still recommend it?
So in the main, although the side effects can be unpleasant, we're typically seeing people not on the day after but day 2 post-vaccine get a bit achy, shaky, fevery, generally not feeling very well. That's a sign actually that your immune system is really responding well to the vaccine. So although it's unpleasant, there are simple over-the-counter remedies like paracetamol, ibuprofen that you can take, because what we know is that the vaccine is preventing against the severest form of disease. So although you might be having some side effects, need to take it easy for a few days, actually compared to getting coronavirus, I personally think it is something we should all consider as part of informed consent.